Wondering how COVID is different in children? Children have a lower risk of infection. This is because the immune system of a child has more naive T cells. Since they have not been exposed to other infections yet, they can detect and deal with new infections better. T cells in adults have already adapted to fighting certain types of infections over the years. So a new pathogen unencountered by their immune system makes them more susceptible to complications. In general, children have milder or fewer symptoms than adults. The waning immune system in adults offers a less optimal response to COVID-19 as compared to children. Also, healthier eating habits and better vitamin D levels in children play a part in milder infections. Thankfully, the mortality rate in children with COVID infections is extremely low, and children are less likely to get infected and have serious symptoms, leading to fewer complications. For more information, visit us at mayacare.com.